Always refer to the written IFU for complete instructions for use. Written and video IFUs are subject to change. Refer to www.tidyproducts.com for the most current versions. Posey Twice-as-Tough Cuffs 2791Q. Application instructions for wrist and ankle. Description of product. Padded limb restraints with double security closure for bed and stretcher use only. Intended use. To protect patients assessed to be at risk of disrupting life-saving treatments, e.g., chronic tube pulling, or in danger of injury to themselves or to others by limiting limb movement in a bed or stretcher. Follow your hospital's restraint policies and procedures that are compliant with USA CMS guidelines and state laws or other governing agencies outside the USA. Contraindications. None. Application instructions. The order of either application or removal of the straps to the bed or the cuff to the patient is to be determined by the clinician. Follow these steps to apply device. Repeat 1 through 2 on each side. 1. Bring the ends of the strap down through the inside of the side rails so they do not interfere when the side rails are raised. Make sure that the straps are attached to the frame that moves with the patient. Do not attach to side rail or head/footboard, out of the patient's reach. 2. Thread the end of the strap over the top around the frame at least once and close the quick release buckle. Listen for a snapping sound. Pull firmly on straps to ensure a good connection. If buckle does not fit an opening, use the alternate method by looping the webbing through the frame opening, inserting the buckle through the loop, and securing the male buckle to the female buckle to secure. Close the quick release buckle by sliding the male end into the female end. To limit unwanted adjustment, tie an overhand knot with the excess strap directly below the quick release buckle. Applying the cuffs. Repeat steps 1 through 3 for each side. 1. Wrap the neoprene piece around wrist/ankle so the buckle and connecting strap is on the ulnar side of the wrist or lateral malleolus of the ankle. Attach the black hook and loop pieces together and pull back the black pull tab on the red fuzzy piece, followed by the red hook and loop pieces. The fuzzy piece should be sandwiched between the two pieces of hook. Be sure to overlap at least 1 inch. 2. Press the hook and loop closure together firmly and make sure it adheres securely. Slide one finger flat between the cuff and the inside of the patient's wrist/ankle to ensure proper fit. 3. Close the quick release buckle on the cuff. Insert one finger flat under the buckle and pull the strap snug, but not so tight as to restrict circulation. Release the quick release buckle, twist buckle 180 degrees, and reconnect. Listen for a snapping sound. Adjusting strap length. Adjust the connecting strap length from the frame to allow desired freedom of movement without compromising patient or caregiver safety. To limit unwanted adjustment, tie an overhand knot with the excess strap directly below the quick release buckle. Ensure the remaining strap ends are secured and out of the reach of the patient. To remove, release the cuff from the patient, release the anchor strap from the bed frame. To limit lower limb range of motion for legs, the clinician applying the strap's crisscross application method can determine which is applied first, cuff or strap, and which end of the restraint is crisscrossed. 1. Attach the cuff that is secured to the bottom right side of the frame that moves with the patient out of the patient's reach to the left ankle. 2. Crisscross the straps and attach the cuff secured to the bottom left side of the frame that moves with the patient out of the patient's reach to the right ankle. 3. Adjust connecting straps as necessary. Tidy offers in-service training aids at no charge. Contact Tidy online at www.tidyproducts.com or call toll-free at 1-800-521-1314.